Hello, my name is Miguel, and today my topic is going to be about medical marijuana. And our result is the FDA should move marijuana from Schedule 1 classification to Schedule 3 classification. I'll define those later. My first significance claim is medical marijuana is not dangerous in comparison to other drugs in Schedule 1. According to the DEA, Schedule 1 drugs, substances, or chemicals are defined as drugs with no currently accepted medical use and a high potential for abuse. Schedule 1 drugs are the most dangerous drugs of all the drug schedules with potentially severe psychological or physical dependence. Some examples of Schedule 1 drugs are heroin, LSD, ecstasy, and peyote. And this is where medical marijuana is considered to be. And compared to these drugs, medical marijuana does not belong. Subpoint B, Schedule 3 drugs are prescribed by physicians. Also by the DEA, Schedule 3 drugs, substances, or chemicals are defined as drugs with moderate to low potential for physical and psychological dependence. Schedule 3 drugs abuse potential is less than Schedule 1, and Schedule 2 drugs more than Schedule 4. Some examples for Schedule 3 drugs are products containing less than 90 milligrams of codeine per dosage unit, Tylenol and codeine, ketamine, anabolic steroids, and testosterone. Medical marijuana fits in this group much better than it does in Schedule 1. My inherency claim is those that cannot access this amenity are being deprived of the benefits it can provide. Subpoint A, it has been reported that cancer patients can benefit from medical marijuana. According to article on cannabis and cannabinoids, cannabis and cannabinoids may have benefits in treating the symptoms of cancer or the side effects of cancer therapies. Also, from cancer.gov, cannabis has been shown to kill cancer cells in the laboratory. Subpoint B, medical marijuana can be used to treat post-traumatic stress disorder, PTSD. And according to article called General Use of Cannabis for PTSD Symptoms, another fascinating discovery, one with implications for PTSD, is that the cannabinoid system is integrally related to memory, specifically to the memory extinction. Memory extinction is the normal, healthy process of removing associations from stimuli. Dr. McCollum explained that an animal which has been administered to an electric shock after a certain noise will eventually forget the shock after the noise appears alone for a few days. Mice without cannabinoid systems simply never forget. They continue to cringe at the noise indefinitely. This has implications for patients with PTSD who respond to stimuli that remind them of their initial trauma even when it is no longer appropriate. By aiding in memory extinction, marijuana can help patients reduce their association between stimuli, perhaps loud noises and stress, and the traumatic situations and effects. Subpoint C, medical marijuana aids those suffering from certain symptoms that cause uneasiness. According to cancer.gov, there is a growing interest in treating children for symptoms such as nausea with cannabis and cannabinoids. Cannabis and cannabinoids have been studied in the laboratory and in the clinic for relief of pain, nausea, vomiting, anxiety, and loss of appetite. For my solvency claim, moving medical marijuana from Schedule 1 to Schedule 3 federally would benefit medical patients and the government. Subpoint A, legalizing medical marijuana would aid those with illnesses, diseases, etc. According to pro-con, the evidence is overwhelming that marijuana can relieve certain types of pain, nausea, vomiting, and other symptoms caused by such illnesses as multiple sclerosis, cancer, and AIDS, or by the harsh drugs sometimes used to treat them. And it can do so with remarkable safety, Indeed, marijuana is less toxic than many of the drugs that physicians prescribe every day. Subpoint B, medical marijuana would stimulate the economy. And the article weighing the pros and cons of medical marijuana. In states where marijuana is legal, cannabis accounts for more than 3% of tax income. California's medical crop alone is worth $14 billion per year, according to the Huffington Post. The potential of this multi-billion-dollar industry to heal the sick, create jobs, pump funds into the market, and trim off billions of dollars in law enforcement is evident. Particularly when you factor in the $36 billion of annual sales in illegal marijuana and the $13 billion spent on prohibition efforts. Subpoint C, crime rate will decrease. According to the article, legalizing medical marijuana may actually reduce crime. After controlling for a host of known factors related to changes in crime rates, we accounted for factors such as poverty, employment, education, even per capita beer sales, among other things. We found no evidence of increases in any of these crimes in states after legalizing marijuana for medical use. In fact, for some forms of violence, homicide, and assault, we found support for declines after the passing of this legislation.